Now we're going to see the class 1C antiarrhythmic drugs. These are the flecainamide and propafenone. These class 1C antiarrhythmic medications block the sodium channels in every state, in the inactivated, activated, and closed state. So they are non-selective. They have decreased activity in the Purkinje cells tissue and in the ventricular tissue. It acts mainly in the AV node. It increases the action potential duration of the AV node. So we have the action potential. This is the normal action potential. We would see giving these 1C antiarrhythmic medications, we would see a prolongation in the QRS because we are blocking the sodium channels, so the QRS would be increased, and the duration overall of the action potential of the myocyte is normal. There is no increase or little effect in the action potential of the myocyte. But in the AV node, it is increased the action potential and the refractory period. In the AV node, there could be a little bit of prolongation in the QT due to the increased duration of the QRS, that is due to the blockage of the sodium channels. Now, these medications are used as last resort. For example, flecainamide can be used in for example, atrial fibrillation or ventricular arrhythmias, but as last resort. This is due to high toxicity of flecainamide. Also, these medications are pro-arrhythmic, especially in hypoxic tissue, so it is contraindicated in a post-MI state after a myocardial infarction. So after that, we will not give them. Also, it would be contraindicated in structural abnormalities of the heart due to increase the risk of arrhythmias. And there is something called the use dependence phenomenon. This is the medication dissociate from the channel in the diastole. So remember what is an antiarrhythmic drug? An antiarrhythmic drug is the drug that decreases the heart rate. So if there is increasing in the heart rate, there is decrease in diastole, and so there is decreased dissociation of the drug and the channel. So increased heart rate promotes decreasing association of decreasing the dissociation of the drug, and so the drug have its effect because it's not being dissociated. So that's the use dependence phenomenon. The other issue is that among the three classes of sodium channel blockers, the 1C class is the one that dissociates slowest from the channels. So here we have this use dependent phenomenon that is amazing, and the other is that decreases has the slowest dissociation effect compared to the other ones. Now in the next video we are going to compare completely these ones, because this one has a different or some differences in the other channel blocker sodium channel blockers.